So, hey guys, I'm your nurse Anna. So, for today's return demonstration, I will be performing urine catheter care. So, what is a routine catheter care? So, a routine catheter care is an indwelling catheter that is used to provide continuous drainage of urine from our bladder. The catheter itself, which is attached to a drainage bag, may be used for episodic or long-term urinary drainage. So, as the catheter is in the bladder through the urethra of our patient, the bacteria will enter the urinary system, so that therefore rather care must be taken to ensure that the surrounding area is clean to decrease the contamination of the catheter by bacterial flora. So our clients may be embarrassed or frightened by the catheter and related care and therefore require our emotional support. So for our assessment, we have to assess catheter patency and urine color, consistency, and the amount while performing the care to determine if catheter and drainage system are functioning correctly. So we have also to determine the condition of the urinary meatus and perineal area to monitor for redness, swelling, drainage, or signs for infection. So we have to monitor vaginal discharge and diarrhea as microorganisms that migrate to the catheter and lead to urinary tract infections. So we have also to determine the client's emotional reaction and feelings towards the catheter. This may prevent untoward reaction to the care and allow us nurses to help our client deal with some deeper emotional issues. So prior in performing the procedure, we have to provide the materials needed. We have this sterile basin with water. We have our clean gloves, our soap, our drape pad, and our washcloth. So prior to performing the procedure, we have to expose the area where we could perform the procedure. So let's begin the procedure by washing our hands and wear clean gloves and provide some privacy to our patient. So prior in performing the procedure, we have to check if the catheter is intact or not. And after that, we have to expose the area where we could start the procedure. Provide a drape pad. Then begin cleaning the catheter 4 inches from the meatus away from the meatus. sorry. So clean the catheter 4 inches away from the meatus. So let's there. Use the clean cloth one direction to another. Have to repeat it again. Have to clean this away from the meatus, then again one direction each stroke. So repeat it 3 times. Let's hold this. Then after cleaning the catheter, we have to perform a perineal care. So let's get a washcloth, then put soap, so let's the labia, and first one side of the washcloth is being used each stroke. So let's fold, then clean the other side. The labia minora will be and then get another clean cloth, repeat it for 4 times. Then get also a washcloth to clean the groin and leg. Imagine that this is the leg of my patients and groin of my patients. And then have to pat dry our patient vagina. after that, and position our patient in a comfortable position, and cover our patient with a linen or a towel. So for our male patient, the same procedure with the male patient. We have to provide a drape pad and expose the area where we could begin the procedure, where we could start the procedure, and expose the area where we could get a washcloth and begin to hold this one 4 inches away from the meatus. Clean in one direction each stroke, and then the other side begin to clean. That's it. Repeat it again with another washcloth. Begin to hold penis on the side. Then perform a pericare to our male patient by getting a washcloth, put a salt, then plus the penis, wet wrap the penis, down, to the other side, circular motion, the other side, then repeat with a clean cloth. The penis well. The other side. Then we have also to pat dry our male patient. Then after that, we have to put away our drape pad. Then for our patient to cover it as a privacy and comfort, and also to dispose the water from the sink, and put the basin in a designated area. and put away our materials that we use in the procedure for male and female patient, and we have to remove our gloves in an appropriate receptacles to prevent infection and contamination. Observe proper hand hygiene before and after the procedure, and throw away all the soiled materials to prevent any contamination, and make sure that you do any times or repeat the procedure anytime that it can be soiled, or if there is a urine or drainage. So this is how we perform a routine catheter care for our male and female patient.